Hello, and today we're going to talk about urinary elimination. Here's our objectives: the role played by elimination, maintaining good physical health, process of urine and feces production, subsequent elimination patterns, differentiate between normal and abnormal elimination patterns, discuss developmental and other factors that affect a client's elimination status, conditions that interfere with the client's elimination patterns, compare and contrast normal and abnormal characteristics, identify diagnostic tests related to elimination and the nurse's role in obtaining specimens, review nursing interventions that can facilitate or maintain a client's elimination patterns, and discuss proper techniques that support a client's elimination needs. First, we're going to talk about urinary elimination. We'll have a separate one for the bowels. Here we see the structures of the urinary system. You've got your kidneys, which are a couple of bean-shaped organs, one on each side. They're located on either side of the spine. The nephrons inside of the kidneys. Inside each nephron is a glomerulus consisting of a cluster of capillaries surrounded by Bowman's capsules and the system of tubules. Nephrons are working units of the kidneys. This is where the urine is filtered out. All the toxins and not toxins, but the waste products are filtered out. Ureters are the tubes that carry the urine from the kidneys down to the bladder, which is like a storage tank. Bladder is a hollow muscular organ located in the lower part of the pelvis. It stores the urine and it signals the brain when it's full, so you get that feeling that you need to void. It empties when you get about 250 to 400 milliliters of urine inside. It stretches, and then you notice that you need to empty that out. The urethra carries the urine from the bladder to the meatus or the opening, and the flow is controlled by a urinary sphincter that opens and closes so that you can hold the urine until an appropriate time to let it out. The length of the male urethra is longer. That's about 8 inches, as opposed to the female urethra, which is only 1.5 inches to 2 inches in length. Here's a picture of your kidney that filters the blood through the nephrons. Metabolic waste and excess water are extracted. It regulates electrolytes by excreting excess amounts and helps with the acid-base balance, retaining hydrogen ions and bicarbonate. Tubules secrete, excrete, and reabsorb electrolytes, water, and other substances. The efficiency of the kidney function promotes the circulation through the renal arteries and the renal veins. Kidneys receive 20 to 25% of the circulating blood supply. They're very important. You can live with just one kidney, but if you do have just one kidney, you have to be careful not to overdo that poor kidney that's doing all the work of both. The nephron is composed of 3 parts: the proximal tubule, the loop of Henle, and the distal tubule. I'm not going to test you over all these anatomical structures and the details of what's inside the kidney, but you need to have a basic idea of how it works. Kidneys are involved with renin production that influences blood pressure. The filtrate collected in the distal tubule becomes urine. Kidneys manufacture 1.5 up to 3 liters of urine in 24 hours. Another rule of thumb, 1 milliliter of urine per kilogram per hour. The usual urine output for an adult should be 30 to 70 milliliters an hour. So if it's under 30, you have a problem. Altered urinary elimination. So normally infants void 5 to 40 times a day. They just go all the time. Preschool children, they've learned to be continent and to hold their urine until it's appropriate, and they may void every 2 hours. Adults tend to go 5 to 10 times a day. Factors that influence urinary elimination, well, neurologic and muscle development, alterations in spinal cord integrity, fluid volume intake, of course, fluid loss through perspiration. If you sweat a lot, you won't have as much urine to expel. Vomiting and diarrhea, of course, you get dehydrated. The ADH secreted by the pituitary, or the antidiuretic hormone, influences that fluid balance in all of these situations. The ADH responds to challenges in the fluid osmolality of the blood. The ADH determines how much the tubules reabsorb or discharge. If fluid intake is decreased or lost through vomiting and diarrhea, ADH is released to increase the absorption of water. Your body is amazing to try to maintain that homeostasis or status quo. If the fluid intake is decreased, ADH is suppressed. If the fluid intake is increased, ADH is suppressed, allowing for more urine formation or diuresis. The total loss of kidney's ability to manufacture urine or a decreased kidney perfusion results in dialysis. You have to do dialysis to filter that blood and get the toxins and the waste out. If your kidneys can't do it, you have to do it artificially. A blockage of the ureters, a disruption of the bladder by tumor or trauma, infection, neurologic damage to the nerves, prostate surgery can alter the function. Changes that occur with aging. There is a decrease in the number of functioning nephrons. There is a decrease in the filtration rate. And there's decreased bladder tone, so you may have to go to the bathroom more often. A decrease in bladder emptying, which results in increased residual or leftover urine. After a person voids, they still have some up inside. They're not getting rid of all of it. That's a problem. Enlargement of the prostate. Of course, this is just for the males. Only they have prostates. But a urethral obstruction caused by an enlargement of the prostate can cause a lot of problems, frequent, very, very small amounts of urination. Incontinence is not a normal part of aging, but incontinence, unfortunately, is a common problem. I like this little cartoon. Altered urination terminology, words that you need to know, hint, hint. Polyuria is excessive urination, going multiple poly all the time, more than normal. Dysuria is painful or difficult urination. Anuria is a lack of urine or less than 100 in 24 hours, less than 100 milliliters in 24 hours. Nocturia, knock meaning night, wakes you up to void at night. Incontinence, you're unable to hold the urine, involuntary urination. Oliguria is a decrease that's less than 400 in 24 hours. Now notice oliguria and anuria are similar but not the same. Oliguria is a significant decrease. Anuria is almost a lack of urine or less than 100. So keep that straight. Urinary tract infections, very common cystitis, is just that inflammation, irritation of the bladder. It can be caused by an irritation of highly concentrated urine. Maybe you're dehydrated and the urine that's left inside there is very concentrated and irritating. Pathogenic bacteria, improper hygiene, wiping the females especially, wiping from back to front can pull that bacteria from the feces into the bladder. Or installation of an irritating substance or an injury. Symptoms are frequency, urgency, like you can't hold it, you got to hurry and go, dysuria, pain with urination, burning, malaise, that general feeling of just not feeling well, foul smelling urine, and maybe even a slight temperature elevation. Now note, in the elderly, by the time they have a fever, they're in really bad shape. They could be almost septic. Usually the changes in mental status are your first clue to an older person with a urinary tract infection. They don't run that fever as quickly as the younger people. Normal characteristics of urine. It should be straw-colored or amber, clear, not cloudy, maybe slightly cloudy, but you can see through it. There should be maybe a faint ammonia smell, but not foul. Specific gravities, there's the range 1.01 to 1.03. pH, it should be a little acidic, ranging from 5.5 to 7. Normal voided specimen is when they need a urine specimen, you have to be sure to send it to the lab within 5 to 10 minutes or put it on ice. If it's sitting there for more than 15 minutes, it starts to break down and change. There are some different kinds of specimens. Midstream or clean catch. If it's just a voided specimen, there's no special preparation, but that's not really sterile. If it is a clean catch, that is when you clean the labia and the urethra prior to starting a stream of urine and then catching some in the middle. That's considered a sterile specimen if it's done properly. The other way to get a sterile specimen is to do a direct catheterization or pull some from an indwelling catheter that's already there. A sterile catheterization is just a quick cath to go in and get the specimen and come right back out using sterile technique. There's also a 24-hour specimen. To do this correctly, you have to let the patient void before starting it and then collect the urine after that. Not that first void, but the urine after that, and then have them void at the very end. The specimen, as you're collecting it, has to be kept on ice so it doesn't go bad. Strain specimens, this is when you're looking for kidney stones. The nurse's role, you have to do some teaching, of course provide privacy, barrier precautions. You don't want to have the patient get saturated or their clothing get saturated with urine if you're helping them obtain a specimen. Sterile technique, as a nurse, you have to know how to do a sterile catheterization. Timely collection, sending it to the lab before it starts to turn within 15 minutes. Prompt transport to lab, monitoring, and reporting the results. So once you turn in that specimen, be on the lookout for what the results are and let the client make sure the doctor is aware if it's infected. Abnormal findings. These are, again, are some more terms that you ought to know. Hint, hint. Glycosuria means glucose or sugar in the urine. Or spilling sugar. Proteinuria is spilling protein in the urine. Hematuria, blood in the urine. Pyuria is pus in the urine. Ketonuria, ketones in the urine. When is this happening? This is when your body is breaking down protein, and those are the metabolites that are being excreted. Based on these results, imaging diagnostic studies may be ordered. Maybe there's an ultrasound or a KUB, means kidney, ureter, bladder, a KUB x-ray, a CAT scan or MRI, IVP, intravenous pyelogram. That's where you have to have an IV and they shoot the dye into the veins, or a cystogram where they put dye up inside of the bladder to see if there's a problem. Renal angiography and pyelography. Pyelo meaning kidneys, so that would be visualizing those areas. Urinary catheters. Okay, so some things about the catheters. Their types are Foley catheter is the most common. That's a closed system where there's a tube into the bladder with a balloon that holds it in place up inside the bladder, and then the tube comes out, exits the body, and goes into a bag system. It is a closed system because it's not open to air. It stays closed to keep it sterile. Suprapubic is where there is a catheter that goes directly through the lower abdominal wall into the bladder. A condom cath would only be applicable to males, and just like it says, that catheter is just attached to a condom end. Instead of going up inside, it's an external device, a condom that's rolled over the penis and then drains the urine into the bag. Female catheter placement. I have included a video link. You can't do it through viewing the video, but you can do this if you're viewing the PowerPoint. You hover over that link and you press Control and click at the same time, and you can visualize that video. This is a really helpful thing. And there's also ATI has a video that I'd like to have you see as well, but this is one of those female catheter placement videos. Again, here's another video. This is the male catheter placement specifically. I would encourage you to take time to view this. And we are doing that in Skills Lab as well, but even so, I think it's worth viewing again. Incontinence. Incontinence, like we said, is not normal, but unfortunately can be a common problem, especially as we age. The loss of normal bladder control. There are different types of incontinence. There is urgency, an involuntary loss of urine in response to a strong sensation or need to empty the bladder. What would be a cause of this? It could be irritating substances in the bladder. It could be a lack of sphincter control, or maybe overfilling the bladder and it's starting to spill before you can get to the bathroom. Stress incontinence. This is where the urethral sphincter is failing and it's an increased abdominal pressure. So when somebody has just a little bit of stress on that bladder sphincter, they leak, whether they're sneezing, laughing, coughing, or even just exercise. It's very inconvenient. Mixed incontinence, which is the most common, is a combination of both stress and urgency. Oh, and it's worth saying pregnancy or abdominal girth, having a large belly, also has a lot of pressure on the bladder and could increase that problem of stress incontinence. The sphincter is unable to maintain that gateway, close that door. Overflow incontinence is poor contractility of the detrusor muscle. So of the bladder and obstruction of the urethra may be related to prostate. This is a prostate enlargement problem or other cause of an obstruction of the urethra. Functional incontinence, that's when you don't recognize that you need to go to the bathroom, either dementia or just a nerve damage of some kind, or even physical barriers or limitation. Functional incontinence can be as simple as somebody that cannot walk and cannot get to the bathroom. They cannot functionally get to the bathroom, and so they're incontinent. That also falls under functional incontinence. Nocturnal enuresis, that's a fancy way of saying bedwetting. Loss of urine at night, which can be due to an overactive bladder, medication. Maybe they just sleep so deeply that they don't even know that they're going, or sleep apnea. Body image disturbance is a problem with this. Increased risk for impaired skin integrity. You can imagine being wet all the time and that irritating urine being up against your skin. Increased risk for infection, of course, if there's moisture down there and all the time. It's a breeding ground for germs. Body image disturbance, you can imagine how embarrassing that is if you have a leak or loss of control in public. These problems can be temporary or they can be permanent. There are some surgeries available to help correct some of these problems with some success. They're not always successful, but some success. Believe me, if it's a big enough problem, it's worth it. May be helpful to do, they always say do Kegel exercises. You're going to say, what are Kegel exercises? That is consciously contracting and exercising the muscles that help control the flow of urine. There is again another video link here that if you press control and click at the same time, the video, and it is a very helpful little video. I would encourage you to watch that. Finally, we have urinary diversions. Urostomies, urinary diversion care, and urostomy bag change video included here. I didn't even know what a urostomy was till I was actually working the floor. I had never even really, maybe I heard it, but I didn't remember talking about it in nursing school. And I had to take care of a patient almost immediately out of nursing school that had a urostomy. And literally the patient taught me most of what I needed to know. So I would hope that you take the time to watch this urostomy video. It's so nice to be able to see what they're talking about as they explain the procedure. It's more common than you might realize. It could be a bladder cancer or some kind of a permanent problem that they're unable to avoid naturally. It's necessary when the bladder is removed or bypassed. One or both ureters can be implanted into the abdominal wall, and the exit is called a urostomy. If it is a bowel, a pouch is constructed from a piece of bowel. The skincare depends on the type of the diversion. So I would like you to see that video if you could take the time to do that. I think it would be worth it. Not that I'm testing you on it, but you really should know what a urostomy is. Here's our objectives again, and hopefully you will continue on and watch the bowel elimination video that goes along with this. Thank you.